Hey guys, it's Talia. I hope you're doing well. This video is going to cover left congestive heart failure, and it stars my mama llama. Left CHF is often caused by a decrease in cardiac output, meaning that the heart has to work harder to give the body oxygen. This usually causes left ventricular hypertrophy or stiffness, and the ventricle can't fill all the way, or cardiomyopathy, which is a dilation of the vessel and it has to provide more force to push the blood out. Other causes can be COPD, coronary artery disease, and risk factors such as hypertension, smoking, poor diet, and genetics. Common symptoms include shortness of breath, pulmonary congestion, you might hear crackles or wheezing with your stethoscope, coughing, orthopnea or positional dizziness, tachycardia, fatigue, cyanosis, clubbed fingers, and edema. This is an example of a patient history taken, so symptoms including shortness of breath, tachycardia, cough and fatigue, past current diagnosis including hypertension and angina, which they're taking medications for. Also have a family history, but improvement with cardiac rehab and nutrition, and no surgeries listed. The following will be an exam including all of the cardiac tests to see which symptoms would be abnormal and which normal. Hi, my name is Talia. I'm going to be your student physical therapist for today. I'm going to start off by asking you your name and date of birth.
Hi Talia, my name is TBrenan, March 4th, 1961.
Alright, so in this exam what I'm going to do is I'm going to just be checking a couple things. I'll have you take off your shirt so I can hear your heart and lung sounds. I'll walk you through everything that I'm going to do, but is that okay with you?
Alright, that's fine.
Let's get started. I'm going to start with your blood pressure.
Okay.
And I'll just need a little bit of quiet while I do this. Go ahead and flip your arm over for me. Good, and I'm going to find pulse here. Alright. Okay, I'm going to go ahead and get started. So I'll just be starting by doing a general examination head to toe. Hold your arms out for me. I'm going to look at your hands. Okay. And go ahead and flip them over for me. And now I'm going to assess the temperatures along your arms. Alright. Go ahead and put your index fingers together like this. Next thing I want to do is I need to assess the pulse right here, so basically your heart rate. So go ahead and flip both arms over for me and you can just relax here. And I'll test the other side as well. Okay. Now I'm going to squeeze your finger just to see how quickly the blood returns. If you can flip your hand over for me. Good. Okay. Now I'm going to assess for a collapsing pulse. So what I need to do is lift up your arm briskly. Do you have any pain or anything that I need to be aware of?
No.
No? Alright. So I'm going to feel this pulse right here again. And I'm going to lift up this arm. Okay, good. Relax. And then now I need to feel the pulse that's right here in your arm. I'm going to be using my stethoscope to listen to your carotid pulse area here. And while I listen, I want you to just hold your breath momentarily, okay? Alright, so go ahead and hold your breath. Alright, and same on the other side. Good. Now I'll be assessing the pulse just on its own with my fingertips here. Do you have any sort of pain in your stomach area?
No.
Okay, so I'm going to ask you to turn your head to the left. And I'm going to press down on your stomach here. I'm going to be assessing your eyes. I just want you to look forward for me. Okay, And I'm going to be checking underneath your eyelid as well, so just give me one moment here. Good. Alright, and now I want you to go ahead and open your mouth for me. And can you stick your tongue up to the roof of your mouth? And so the next thing I want to do is inspect your chest wall here. Go ahead and lift your right arm up for me. Okay, and the left arm. Alright. And now what I'm going to have you do is I'll have you lift up your left breast tissue so that I can feel for the heartbeats right under here and in here, okay? Okay. Alright, and I'm going to feel right in here. And now I'm going to be assessing for the valves. So you have 4 valves, one right here, one right here, and then 2 up here. Now I'm going to be listening for your different heart sounds. So this is what's called oscillating. And I'll be needing to listen to those same spots that I just felt with both sides of this, okay? To see if there's any abnormal heart sounds or anything like that. Okay, I'm going to flip it over and do the same 2 spots. Alright, and now I'll move up here and do the other 2 spots up here. A couple more sounds that I'm going to be looking for just right in here. Alright, other side. Alright, and now what I'm going to have you do, I'm just going to place this right here. I want you to sit up quickly for me and take a nice deep breath in. And you can go ahead and relax. Normal breathing. The last one that I'm going to be doing on the front is I'll need you to lift up your breast tissue again. And I'll just be listening right in here. And I need you to turn to your left-hand side. Okay, so now I'm going to be listening to a couple sounds at the back, some lung sounds. And now I'm going to feel around your sacral area to see if there's any edema. And then the last thing, I'll just be putting pressure on your ankles. Okay, good. Thank you so much. So following that cardiac examination, there are some other tests and measures that may be beneficial, especially an echocardiogram, which helps to measure the ejection fraction and assess bicuspid valve function, blood pressure, which was taken in the beginning, a stress test on a treadmill or a bike if a patient is mobile, and RPE to rate their exertion in addition to vitals. So this slide is looking at ejection fraction, which is equal to the stroke volume over the end diastolic volume, essentially telling us how much of the blood in the ventricle is being pumped out. It's best measured by echocardiography. A normal percentage would be 50 to 70, and below 40 would be systolic heart failure. However, if they do have a preserved ejection fraction, it could also be diastolic heart failure. Alright, so now I'm going to assess the patient head to toe. So I'm going to start with the head and move to the toe. What are symptoms that you've been having?
Sometimes I suffer from shortness of breath.
Take 2.